Good morning, and welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I'm Julia Chosey with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to review the Health Topics feature in hhdw.org. All right, in previous coffee breaks, we've reviewed the different ways of searching data on hhdw.org and hawaiihealthmatters.org. We've discussed going straight to the data source to build your own reports, and the data sources available on hhdw.org are birth records, death records, the Behavioral Risk Factor Surveillance System, the Pregnancy Risk Assessment Monitoring System, the Youth Risk Behavior Survey, and the Youth Tobacco Survey. We've also discussed using community reports feature, so this is a good resource when you want to look at multiple measures of health in a given community and see how they compare to the state as a whole. The communities that we currently have available are county, race, ethnicity, and sexual or gender minority. Today, we're going to talk about health topics. The health topics module is a good place to start when you know your subject matter, but aren't really sure which surveillance systems have information relevant to your topic area. We launched the health topics module in 2019 with 10 topic areas and have since added 10 more for a total of 20 topics. So here you can see all 20 topics available from alcohol to tobacco. Each health topic is composed of two parts. On the left side is the text that gives you important information relevant to the topic area, and on the right side is where you find the data. In the text on the left side, each topic includes a definition of the topic with key terms, followed by sections which answer the following questions: why it's important, what is known, who is at risk, and how to reduce risk. For the data on the right side, each topic includes three options for exploring the data: indicator reports, which include HHDW Health Indicator Reports and Hawaii Health Matters dashboards, customizable reports, and how it's tracked. Let's take a closer look at the data options. Indicator reports come in two flavors, either HHDW Health Indicator Reports and Hawaii Health Matters dashboards. HHDW Indicator Reports will show you the data by race, ethnicity, county, and sexual or gender minority. So if you've used the community reports feature in HHDW, this will look very familiar. The Hawaii Health Matters dashboards provide a customized collection of related health indicators displayed on our sister site, Hawaii Health Matters. Here you can see the dashboard for health insurance, displaying all the indicators involving this topic area. If you've used Hawaii Health Matters, this will look familiar to you. And these dashboards are a great way to get a feel for what data is available around a given topic. The customizable reports are the indicators in hhdw.org that are relevant to the selected health topic. Here we see indicators available for death records, BRFIS, PRAMS, and URBIS. If you click on the arrow to the right of the data source name, the window expands to show you the specific indicators available from that data source. Sometimes a single data source will be divided into relevant categories of indicators. Here we can see the options available for the mental health topic area. And as you can see, the indicators have been categorized by topic area subtopics, such as adverse childhood experiences and cognitive decline. If you click on the arrow to the right of the category, the window expands to show you the specific indicators available for that category. After seeing all the response options for customizable reports, you can click on your indicator of interest and it will take you to a default report with the three most recent years of data. The data is displayed in both chart and table form. And if you've used the Build a Report feature on HHDW, then you'll recognize this as the default indicator report that can be customized to display the data in any way that you want. The last option in the data section shows how the data is tracked. This highlights data sources with information relevant to the topic area. The hyperlinks will take you to further information about each data source. And here is also where you can quickly access the Healthy People 2030 objectives related to the topic area. Let's go ahead and switch to our demo mode. I invite you to open a browser and follow along. As usual, I'm going to start on our HHDW homepage. And you can see here again the different ways that we've talked about finding data. So going straight to the data source, looking at community reports. And today what we're going to talk about are the health topics. So again, here are the 20 different health topics that are available currently. We do continue to add and adapt them. And there's also a brief tutorial here and a more in-depth webinar here that gives you information about using the health topic. So let's take a look at one of these. Let's look at injury and violence. What we'll see straight off is just a basic introduction to the topic with any important definitions or key terms. And then we get into a little bit of the data for why it's important and what is known, who is at risk, and how to reduce risk. If we continue to scroll down, here are the references that are cited in the text. So if you want to look at any of those more closely. And then below that, we also have some related publications and resources. So there's a lot going on here, and that's without even touching the data yet. So now let's look at the data. So now we're going to focus on the right-hand side here. And as I mentioned, the HHDW health indicator reports are tied to our community reports. So when you click on one, for example, we'll look at bullying, it's going to give you the data by race, ethnicity, by county, and by sexual or gender minority. And as you see, you can hover over the graph to get the data values. You can also, if you're interested in just looking at one characteristic, you can select a smaller report, a smaller data view. Or if you do want the data tables, you can select the complete report, and this will give you information about why it's important, and then additionally the data tables with the graphs and a map and additional information. So those are just a few ways that you can look at the data. This is a great report if this indicator is something that you're interested in and you want to share it with somebody else. You can print and share the page here. You can also email it. Or if you're really excited and you want to share it on social media, you can do that too. So that is what our health topic, our HHDW indicator reports look like. And those, again, if you've used the community reports, those will look pretty familiar to you. Now, below that option, we have our Hawaii Health Matters dashboards. And what we've done here is for each one of these categories, we've pulled all the indicators relevant to the category together into a curated dashboard. So, for example, if we want to look at intimate partner violence, now what we're seeing are all of the indicators that are relevant to intimate partner violence that are available on Hawaii Health Matters. So right now there are 4 of them. And for those of you that have used Hawaii Health Matters, this should be very comfortable to you. Very briefly, for those of you who haven't, let me just explain so that we do get the point estimate from the most recent year of data. And then we get these values that provide a little bit of context to that value. So we can compare our state value to the US, we can compare it to the prior value, and we can compare it to the 3 previous data points and looking at a trend. If you're using the site and you need to be reminded or you see an icon that you're not familiar with, this legend is always available here on the left-hand side to help you out. If you're interested in a little bit more data, if you click on the indicator, you can get the actual definition, a little bit about why it's important. And now, in addition to these comparison values, you get trend data. So this shows you how the indicator is changing over time. And then you get subgroup data. So this shows us the indicator by gender, grade level, race, ethnicity, and sexual orientation. So it's a good way to identify disparities. And then there's also a geography section here where you can look at the indicator by different geographies. And then below that here is where you get the related content that makes Hawaii Health Matters a little bit more user-friendly. So this provides you with a lot of different reports and websites and presentations, things that have to do with intimate partner violence among teens. So that's what the Hawaii Health Matters dashboards look like. Once we get down into the customizable reports, these are the indicators that are available in HHDW. So you can see for injuries and violence, we have death record data. We have BRFIS data, both for adverse childhood experiences and falls and safety. We have PRANS data, And then we have Urbis data for 4 different subcategories of injury and violence. So once you have an idea, say you're interested in youth violence, then you might want to focus on these YRBS options. So we'll look at the fighting and weapons option. When you click on it, opens up and shows you all of the individual indicators that are available for that category. So if you see one that you'd like, for example, let's look at physical fighting in the past 12 months among high schoolers. When you click on it, it gives you this default report query. And for those of you that have used hhdw.org, you'll know this looks very familiar. What this is showing you is the 3 most recent years of data for the state. So it gives it to you in chart form, and you can hover over the chart to get the data values, or you can also scroll down and look at the data table to get the values here. So we get our point estimate, our upper and lower 95% confidence intervals, our count, and our average annual estimated population. There's also an indicator of stability here, so that if there's an unstable estimate, you're aware of it and can treat it with caution. Below the data table, we have shortcuts to exploring a different data set. So say you decided, oh, you know what, I don't actually want to look at youth violence, I want to look at adult violence. You could switch to the behavioral risk factor surveillance system. Or if you want to choose a different health topic, you can do that here. Below the data, below that, then are our technical notes. So here's where you can see how the question is actually worded. There's information about suppression and weighting. There's a suggested citation if you want to use any of the data in a report, and additional data issues. So this is good. It's fine print that's important to know that it's there and to keep an eye on it. So for those of you who have used HHDW before, you know that there's a lot more you can do than just look at the 3 most recent years of data for the state. And you can do that by modifying the query. So here's our query builder page. And what we're looking at, these first 7 steps are really like filters. So for example, if you were only interested in seniors, you could pick 12th grade here. Or if you were only interested in boys, you could limit your data results to boys. There's also race, ethnicity, and some other demographic characteristics that you can use to filter. If you want to look at the whole population, but you want to look at it broken out by one of these characteristics, then you use step 8 to tell the system how to display the data. So in this case, the default, again, we're looking at the data by year. But say we wanted to look at it by grade. Now, if we submit this, what we're going to be seeing is the 3 most recent years of data displayed by grade. So we can see some of the differences in physical fighting over grades in high school. And again, you can hover over the chart. You can export the table to Excel if you'd like to do your own visualizations. But here are all the data that you need. As you can see here, there's a lot of different ways that you can look at the data. So you can look at it by sex, by race, ethnicity, by sexual orientation, by transgender. And the cool thing about this system is that you can actually look at it by 2 things at the same time. So for example, if we wanted to look at grade and sex, now we're seeing here that it looks like females are less likely to be physically fighting than males, and you can still see some differences across the grades. If you were just interested in looking at female, you can click on male and it'll just show you the female data. Click on male again to bring it back. And again, here's our data table with all of our values. So this is a great way to explore the data. Again, you can look at the data by all sorts of different categories. And then when you consider that you can filter the data too, it really provides a flexible system. So this is the last of the customizable reports. The one thing that I wanted to show you too before we move into the activity is this last window down here of how it's tracked. So what this provides is information about other data systems that collect data around your health topic. So it's a great way to explore what other kinds of data sources might be available. And you can also quickly get to the Healthy People 2030 objectives related to the health topic area. So in this case, it would be injury prevention and violence prevention. Now let's give you some time for some hands-on work. Take a few minutes to explore the health topics module in hhdw.org and answer these questions. I'll go ahead and go over the answers to these activities. So the first question is asked, who is at high risk for arthritis? So that's pretty straightforward. All we need to do is go to our health topics, go to arthritis, and see who is at risk. So we can see that the prevalence of arthritis increases with age. Females are more likely than males, and Native Hawaiians are more likely than Caucasians. And then there's also some risk factors like particular genes or having chronic conditions like heart disease or diabetes or joint injuries or infection. So that is the answer to the first question of who is at risk for arthritis. The second question asks, in 2022, what percentage of adults in Hawaii use marijuana? So again, we can go to our health topics. We'll go to our drug health topic, and there's a couple of different ways that we could answer this here. So first of all, I'm seeing that there's a dashboard on marijuana use. So I'm going to try that first and just see if it has our basic indicator of adults who use marijuana. And it does. So we could answer the question right now at 11.8% of adults use marijuana in 2022 in Hawaii. However, you could also, if you wanted to, go straight to the data source. So here we can see that this data source is the Behavioral Risk Factor Surveillance System. So you could go straight to BRFIS and see, okay, oh, here we go, here's marijuana current use. And if we select that, we're going to get our default report that gives us the 3 most recent years of data. So here again, we could see that 11.8% of adults used marijuana currently. And what are some sources for data on sexual health? So this is a great time to use that, how it's tracked option. So we were interested in sexual health. And here you can see some of the data sources that are available around sexual health, and also the links to the Healthy People 2030 objectives that are related. So here are the answers. And again, thank you very much for your time today, and I hope to see you next month. Join us in November for our next Coffee Break webinar. Please note that due to the election day on Tuesday, November 5th, we'll be having our Coffee Break webinar on the second Tuesday of the month, which will be November 12th. So at 11 a.m., we will be discussing sexual orientation and gender identity in HHDW and Hawaii Health Matters.